This is a University of Otago podcast.
All right, so we're going to take into the second talk, and it's Ching and Sandy Mandic, sorry, from the School of Physical Education, Sports and Exercise Science on a built environment and active transport in schools. So they're going to speak about that for 10 minutes.
Thank you. I'll do first. Thank you. Thank you very much for coming here today. It's a pleasure to share with you some of the work that we've been doing in the School of Physical Education for the last 3 years. Keck is doing her master's on this project, and she will share with you a little bit of work that she's doing around her master's. So our study is about active transport to school, and we're looking how children and adolescents travel to school. I will change it. So when we talk about active transport, if somebody is walking or cycling to school, we call that an active transport. So you need to use your body to get from point A to point B. If you're using car or a bus or maybe a motorcycle, any kind of motorized type of transport, we call that a motorized transport. And sometimes people use a combination of both. So with this study, it's a really nice collaboration of the university with Dunedin City Council, Dunedin Secondary Schools Partnership, and the study is actually addressing several disciplines. It's very multidisciplinary, and we look into physical activity area, health area, transportation, built environment, but also some implications for education. So what we're doing in our research, we're understanding that individuals don't necessarily make decisions themselves, especially if you're talking about young people and adolescents. So there are some individual factors, but they're influenced by a wider sociocultural environment. So they're influenced by what their peers think, what their parents think, and, for example, the school environment. Individual decisions in this case are also influenced by a built environment. Are there enough cycle paths? Are there enough footpaths to get to the school? Or how far away they live from the school? And finally, like in many other cases, we're influenced by a policy environment, which many individuals are not aware of, and that can be policies on a school level, city level, or national level. So in our study, we've surveyed parents and adolescents. We asked them a little bit about them. We asked them what they think about walking, cycling, driving, or traveling to school by bus. We looked into their health behaviors, such as physical activity, screen time, and food habits. We looked at the built environment, what they think about the built environment, but also assess how that built environment in their neighborhoods and around their schools look like. We asked them about perceptions of driving. We asked them about mobile phones. We measured their school bag weights. So I'll show you how heavy the school bags are. And we also gave them to wear an accelerometer. And Keck has it here, and she will show it to you a little bit later how it looks like. It's a little activity meter that measures how much physical activity people do. We had them complete the maps, how they get to school, and mark the areas that are safe or unsafe, and we also had them do some focus groups and tell us about what they think about walking and cycling to school. We've had an amazing 100% school recruitment rate in Dunedin. All 12 Dunedin secondary schools have taken part. It's been a really wonderful study and a great success. And for researchers in the audience, this is not going to be surprising, but it's actually for the public just to show that something that we've done takes many years. It's not necessarily something that we can pull off in a couple of weeks. So some of the results I'm going to present to you in a few moments are actually work resulted from last 3 years of building collaborations, getting the funding, collecting the data, and then starting the data analysis. So we're actually just in a stage right now that we're still collecting some data, but just the final last parts of the project, and then reporting the data and analyzing them and presenting them. So let's have a little look about travel to school. How does it look like in Dunedin? So we see that about 1/3 of adolescents said they most of the time or all of the time walk to school, very few cycle. And for motorized transport, about half of them are driven to school, 5% drive themselves, and about 20% use bus. And you will see that these percentages don't add up to 100% because there is actually about 16% of them that use a combination of different types of a transport to school. So we looked in a distance. We know where people live, so we used the geographic information system analysis, and we determined the network distance, if they take a path or a road, how to get to school. So on average, there was a distance 6 kilometers to school. We calculated what would be a reasonable distance for Dunedin to actually walk to school, and that distance is determined to be about up to 2.2 kilometers. Adolescents will actually walk to school. And we have about 32% of adolescents in Dunedin who live within that distance from school. We don't have any cycling happening in Dunedin, so we couldn't determine what's the optimal cycling distance in Dunedin, but from other research from other countries, it shows it's about 4 kilometers. And as you can see here, about half of the adolescents that we surveyed live within that cyclable distance to school. And then we have another half that actually live beyond 4 kilometers, so they couldn't necessarily use walking and cycling to school. So we'll show you some of the data and some of the interesting findings that are coming from this study. So these are the maps. We asked students to complete the map how they get to school. And this is, for example, a map based on 9 schools. And you can see different color coding, which routes students are taking to get to school. And that can actually inform the policy development and also built environment change in our city down the road. And we do have the information how safe or unsafe those routes are. But these are some of the data from the survey that looked into students who live within those 4 kilometers from school, which is that cyclable distance. And you can see that about a third of them has a problem with the traffic. There is too much traffic. The traffic is there are too many hills. There is a boring route, and there are dangerous crossings. And that is certainly one of the things we can all appreciate in Dunedin. And there is another thing we asked them, is it just basically more convenient for somebody to drive you on the way to school? And we have a 50% of these adolescents saying that convenience is one of the reasons why they actually don't necessarily walk to school. Here is now the analysis of the city and showing the routes that students marked as or perceived were unsafe. So anything that you see here that's basically red line, those are the routes that students marked as unsafe. And we actually looked at the reasons why they marked it as unsafe. Is it a built environment issue? Is it a traffic issue? Is it a personal safety issue or other issues? But I'm not going to present it to you here today. But it's basically, this information is very useful for the Dunedin City Council to build information about where there is a need for some built environment changes. As you know, Dunedin is also very much into building a cycle lane, so we actually looked into these perceptions of walking versus cycling to school in Dunedin, and we found that basically there is less interest for cycling in adolescents, and this is all adolescents that live within that cyclable distance of 4 kilometers. They're not intending to do it, it's less preferred, there is not enough social support, there's not enough encouragement from friends or parents or schools, and it's perceived as less safe. Something quite interesting. We also asked them what would potentially encourage them to cycle to school, and what we found that it's cycle-friendly uniforms are something that's an issue, especially for the girls, storage of the bikes at school, and safer traffic. There are a few other things the adolescents reported. For example, if they have the bike, so there is actually about a 1/4 to 1/3 of adolescents that reported they don't own the bike, and also if there are bike racks available on the buses free of charge. There was some concern that maybe because the helmets are required for the cyclists in New Zealand, that's an issue, but we saw that that's actually the least of an issue for encouraging cycling to school in Dunedin adolescents. So I'm going to hand over to Kek, and she'll tell you a little bit about physical activity.
Thank you, Sandy. And I'm happy to be on board this year to know more about active transport to school, because coming from Singapore as a primary school teacher, we have actually overlooked the fact that going to school and going to and fro school could help. Excuse me. Okay, moving to and from school actually could help pupils or students increase their activity level. So this is something that I can bring back to Singapore once I graduate from here. Now, what about physical activity? Now, the activity meters that you see is something that the students who are involved in the study, they wore for a week. And from there, The levels of activity can be seen on the activity graph. Charlotte is going to pass some activity meters around for you to take a look. It is very, very light and is easy to be worn around the waist, the hip. Now, the activity graph actually calculates how active a person, how much activity a person did through the day. And the higher the bars that you see on the graph, the more intense activity the person has done. Now, so for example, this person has done vigorous activity at about 9 o'clock in the morning, and throughout the day, there'll be about light activity, and there's a time interval where the person did no activity. Okay, so this is a very useful graph for you to detect your levels. Now, it is recommended that for children and adolescents to be active for at least an hour a day. Now, that is the guideline. Now, for the students in the study, this is how they travel to and from their school. And based on that, the question is, choosing these modes of travel, how did they fare in meeting this physical activity guideline? Now, as you can see, students taking active transport or a combination of active and motorized transport met the physical activity guidelines, because half of the students were able to do that, compared to a third of the students who used motorized transport to school. So this is actually quite interesting to know that they actually were able to keep themselves physically active for at least an hour a day. Yeah, and based on our results, we also found out that pupils using active transport or a combination of active and motorized transport, they were actually accumulated higher minutes of activity before school, an hour before school, and an hour after school. But there was no difference with the three transport groups in the late afternoon and in the evening as well. This is what we found out there. Thank you. I'll hand the time over to Sandy.
And I'll just finish off with showing you the school bag weight. So we actually measured over 500 school bags, and those ones that actually had a full bag weight, the average weight was 5.6 kilograms, and on average that was over 9% of adolescents' relative body weight, so percent of a body weight. And based on the guidelines, anything about 10% of body weight actually has a negative impact on the musculoskeletal health. We had a 38% of students who had a bag weight over 10%, and we had another 8% that actually had a school bag weight over 15%. And what we found, the school bags were really heavier in boys, so they had particular risk, and also underweight adolescents were at a particular risk from this. To finish off, these are the main reasons why parents drive adolescents to school. It's basically the convenience, distance, and child has too much to carry. We have a few other reasons, but they're not as important. We're still recruiting parents for the BEATS parental survey. If anybody's interested, you can contact us. We have some great rewards there. And we're sharing our findings with the public on a symposium in July, so anyone is welcome to join us. I want to thank the team who has been working hard on this. And this is the laboratory in which we work, and we're happy to take any questions. Thank you.
Does anyone have any questions? Because if not, I have some. So you noted board size as boredom as being an issue with why people said they didn't bike. How big do you think the effect size is? Like if it was flat and no traffic, how many of those who say they're bored with the route would actually, do you think that would be an effect? if you understand what I mean.
Yeah, so we are looking at the effects of the built environment. We're looking at the effects of topography. That's one of the aspects that we're going to actually look at. What's the reasonable distance in a city like Dunedin when we take into account the topography? And we're yet to look into simulations, so to speak, like what do we do if any of these variables change? How can we predict what would change with the active transport? It's a little bit difficult to make any conclusions like that based on a cross-sectional study. If it was interventional or longitudinal studies, we could actually manipulate some of those variables, but we're kind of limited to cross-sectional design at this stage. But this study is designed to be a comprehensive baseline data for a future natural experiment, because we know that city is building the cycle lanes around the city, so we're actually hoping to go back into the schools in 5 years' time and see whether the changes in the actual built environment have led to the changes of the perceptions of the built environment and also changes in the behavior.
Oh, yeah, interesting. Cool.
Yeah.
I certainly remember as a child that the boy with the heaviest bag did have a sort of a point of pride as well. So that's interesting that the data fits that sort of perception as a child.
Yes.
Cool. Do we have any other questions? No? Okay, cool. We'll just wrap it up there, and then we'll get the next talk going as soon as we can.
Thank you.